how to express what I'm feeling when I see you. You flash a smile, I'm like, is this happening? I look you in, then of course drop everything. You walk over and ask if I'm alright. Hey, whatever it takes to break the ice. Don't walk away, there's more to say. I just need the courage to let you know what's on my mind. Like every time you pass by, something must be what's right. Not everything is energy locked up. It's ready to scream and shout. I won't make the same mistake twice. Ready to shake up and break the ice. Maybe a joke first, maybe a pickup line, but either one of those is just a waste of time. I need a better way, I need some inspiration, something that better explains all my motivation. To meet you, know you, and be on your mind. I have to, but how do I put this right? Don't overcomplicate, just say hi or whatever it takes to break the ice. Don't walk away, there's more to say. I just need the courage to let you know what's on my mind. Like every time you pass by, something must be what's right. Not everything is energy locked up. It's ready to scream and shout. I won't make the same mistake twice. Ready to shake up and break the ice. Do you have a roadmap that I can try? 'Cause I think I just got lost in your eyes. I have to tell you, I really want to. Whenever I look in your eyes, I won't make the same mistake twice. I'm ready to shake up and break the ice. Don't walk away, there's more to say. I just need the courage to let you know what's on my mind. Like every time you pass by, something must be.
Hi, very good evening. So today's live session we shall focus on pharmacology, right? Few topics from pharma. So first pass metabolism, protein binding drugs, chloramphenicol, drug interactions. One example for drug interaction and also regarding potency, right? So I hope it is streaming fine, and I also hope that you have gone through the soft copy of MCQs and you have solved them. So we shall have a discussion pertaining to the same, right? So a very good evening all of you. Hi Srish, Devna, Neha, Bernice, Samya, Richa, Ganga, Sakhi, Karishma. Hi, a very good evening. Right, we will start off with our first question. All of the following drugs bind to albumin except barbiturates, NSAIDs, penicillins, beta blockers. So among the following, which doesn't, or identify the drug which doesn't bind to albumin. So we have drugs which bind to albumin and few drugs which bind to alpha-1 acid glycoprotein, right? So most of the drugs are protein binding drugs. So protein binding helps in prolonging the duration of a particular action or therapeutic action of a particular drug. So of the following, which is not albumin binding drug? So in fact, we have a list of drugs given in your tripartite where you have those drugs which are mentioned, like you have drugs binding to albumin on one column and you have drugs binding to alpha-1 glycoprotein, right? Acidic drugs and then basic drugs. So what is the right answer? Hi Nasrin. All of the following drugs bind to albumin except barbiturates, NSAIDs, penicillins, beta blockers. Yes, Nasrin. Drop a mail. We'll send you the details. Hi, Ipsita. Good evening. So Devna says option D. Ganga also says option D. So it's purely memory based, right? So as I said, we have a column, we have a table in our textbook mentioning various drugs which bind to albumin and those drugs which bind to alpha-1 glycoprotein, alpha-1 acid glycoprotein. So option A, B and C, that is barbiturates, NSAIDs and penicillins, they bind to albumin, whereas beta blockers bind to alpha-1 acid glycoprotein, right? So option D is right answer. Protein binding. So to give you the list, those drugs which bind to albumin include option A, B and C, and along with that benzodiazepines. Since you have barbiturates, you can even remember benzodiazepines, and you have NSAIDs and penicillin or antibiotics as mentioned. Other antibiotics such as sulfonamides, tetracycline also bind to albumin, and apart from this, valproic acid, phenytoin, right, anticonvulsant drugs, phenytoin, valproic acid also bind to albumin, and anticoagulants, oral anticoagulants like warfarin also bind to albumin, right? So we have these list of drugs which bind to albumin, plasma protein albumin. So barbiturates, benzodiazepines, NSAIDs, valproic acid, phenytoin, penicillin, sulfonamides, tetracyclines, and warfarin. And the rest of the drugs, as mentioned in the table, beta blockers, various local anesthetics like bupivacaine, lignocaine, right? And then you have prazosin, alpha blocker, prazosin, quinidine, verapamil, right? So all these are binding to your alpha-1 acid glycoprotein, right? Exactly. You can remember it as AA, all acidic drugs bind to albumin, right? We have discussed that previously also. So now soon you can drop a mail at proudtobedentist@gmail.com. We'll send you all the details, right? Now moving on to the second question. So option D is right answer, fine. Now moving on to second question. So in fact, as we discussed, pharmacology is really challenging. We have many concepts to remember, to memorize, so it's always advisable to maintain notes, and this is for this reason we're asking you to maintain notes, right? Now moving on to second question. High first pass metabolism is the name. Again, purely memory based. So in which of the following drugs do you find high first pass metabolism? As you know, first pass metabolism is nothing but once a drug is given through a specific route before entering into the systemic circulation, the metabolism that's happening in the route can be considered as first pass metabolism. First pass metabolism is mostly occurs in case of GI as well as liver if a drug is taken through oral route, or if it is through inhalational route, even lungs, there can be first pass metabolism to some extent. But GI, gastrointestinal tract as well as liver are major sites for first pass metabolism. Because of this first pass metabolism, the bioavailability of drug is reducing. That's the reason why we say a drug with 100% bioavailability, or the route with 100% bioavailability, is intravenous, right? So which among the following drug has high first pass metabolism? Phenobarbital, theophylline, metoprolol, morphine. I'll repeat the options: phenobarbital, theophylline, metoprolol, morphine. Yes, Rish, thank you for giving the mail ID. First pass metabolism. Okay. Right. So I'll just give you the list. It says morphine is the right answer. Morphine has highest first pass metabolism. Those drugs which have low in fact, option A, phenobarbital, comes under the category where there is very low first pass metabolism. Same in case of theophylline. Even in theophylline, there is very low first pass metabolism. And then coming to metoprolol. So metoprolol comes under intermediate category. So based on the first pass metabolism, or the amount of first pass metabolism we see, we have low, medium or intermediate, and then high. So option A and B, you can just write down alongside option A and B as drugs having low first pass metabolism. Metoprolol intermediate category, whereas morphine comes under high first pass metabolism category, right? So option D is right answer. And to just add up few more drugs, those drugs which are having very high metabolism, high first pass metabolism include isoprenaline, lignocaine, hydrocortisone, testosterone, propranolol, alpranolol, verapamil, salbutamol, glycerin trinitrate, morphine, as well as pethidine. Right? You have this table in your Tripartite pharmacology textbook. You can refer that for more information. Right? Yes. You're never too late. Thanks to technology, a recorded video is still available. Right? So you'll be missing almost nothing. Right, so option D is right answer, morphine. And morphine also pethidine. They have high first pass metabolism. Now moving on to third patient. Chloramphenicol. Chloramphenicol binds to 30S ribosome, 50S ribosome, amino-acyl tRNA, all of the above. So how does chloramphenicol act? Mechanism of action. So as you all know, chloramphenicol antibiotic, which has this antimicrobial nature through protein synthesis inhibition, isn't it? Rohit says all of the above. Nasir, Karishma, Devna, Neha, and Srish say option D, 50S. So you mean to say 50 subunit? Yes, Deepak. Yes, so chloramphenicol inhibits protein synthesis by interfering with transfer of elongating peptide chain to the newly attached amino-acyl tRNA at ribosome mRNA complex. It specifically, chloramphenicol specifically attaches to 50S ribosome and thus hinders the access of amino-acyl tRNA to acceptor site. So it acts as a peptide analog. In fact, chloramphenicol acts as a peptide analog, binds to 50S, blocks the protein chain synthesis or protein amino acid propagation, right? So chloramphenicol inhibits bacterial protein synthesis by interfering with transfer of elongating peptide chain to the newly attached amino acid tRNA at ribosome mRNA complex. It specifically binds to 50S ribosomal subunit. And remember, at very high doses, chloramphenicol can also inhibit mammalian protein synthesis. As a result, bone marrow suppression can be seen at very high doses. Right? So option B is right answer. I hope it's clear. Now let's move on to the next question, penultimate question. We had a similar kind of question in NEET 2018 also, right? We had in fact 3 or 4 patients on drug interactions, if I'm not wrong. A female patient on oral contraceptives takes penicillin antibiotic. What would be the possible outcome? Option A, failure of antibiotic. Option B, failure of contraception. Option C, both. Option D, none. The contraceptives are taken to avoid pregnancy, isn't it? So a female patient on oral contraceptive takes penicillin. What would be the possible outcome? Failure of antibiotic, failure of contraception, both, none. Yes, Komal, Devna, Bernes, Srish, Yashwant, Sridhara, Aman, Anushka, Rohit, Sunita, right. So failure of contraception. Okay, can anyone of you explain how this failure happens? What is the probable mechanism? What is that interaction that's happening between penicillin and this oral contraceptive that leads to failure of contraception? Yes, Ganga, penicillin. Yes, penicillin group of drugs. can cause failure of contraception. To be more specific, as you said, ampicillin or amoxicillin. Ampicillin or amoxicillin. Enzyme inducer, enzyme inhibitor. Yes. So amoxicillin or ampicillin penicillin group of drugs, they inhibit enterohepatic circulation of estrogen, thereby leading to failure of contraception. Hence advised alternative contraceptive measures, right? So these antibiotics interrupt enterohepatic circulation of estrogen. Just make a note of this point, very, very important, right? So there is interruption of enterohepatic circulation of estrogen, leading to failure of contraception. Yes, they will know. Well said. The interruption of enterohepatic cycling of conjugated hormone. That's true. So option B, failure of contraception, is right answer. And as Ganga rightly mentioned, ampicillin or amoxicillin to be more specific. Now let's move on to the final question. Rank order or rank the order of potency of agonists on alpha receptors. Or the question is rank order of potency of agonists on alpha receptors. So you have alpha receptors and you have agonists like adrenaline, noradrenaline or isoprenaline. Rank them based on their affinity towards these alpha receptors. So the question is rank order of potency of agonists on alpha receptors. Option A, adrenaline greater than noradrenaline greater than isoprenaline. Option B, noradrenaline greater than adrenaline greater than isoprenaline. Option C, isoprenaline greater than adrenaline greater than noradrenaline. Option D, none of the above. So rank order of potency of agonists on alpha receptors. So Ganga says option A. Neha, option A. Hi Harjit, very good evening. Okay, Devna. Thank you for adding up that point. Loss of conjugated hormone by fecal route. Fine. Yes, Kaji says option A. Devna, Komal Sharma says option A. Yes, Soumya. So you said the order of potency of these agonists on alpha receptors is adrenaline greater than noradrenaline greater than isoprenaline, which is absolutely right. Option A. If the question is rank order of potency of agonists on beta receptors, then what would be the sequence on beta receptors? If it is alpha, as you said, adrenaline greater than noradrenaline greater than isoprenaline. If it is on beta receptors, what would be the order? Is it the same or is there any variation? Yes, Kaji, yes, Rohit. Yeah, if it is alpha receptors, adrenaline, nor, and iso. If it is beta, iso comes first. Isoprenaline greater than adrenaline, greater than noradrenaline. Not exactly reverse bias. You will have isoprenaline, following which you have adrenaline and noradrenaline. In fact, we had this question previously also. Right? So these are some of the points which I wanted to highlight in this live session. So we'll just have a summary of all that we have discussed so far. So initially we have gone through the table of drugs which specifically bind to albumin and those which specifically bind to alpha-1 acid glycoprotein. We have seen the list. And secondly, we have gone through various drugs undergoing either low, intermediate or high first pass metabolism. We have tables for this in your textbooks. You can refer them, make a note of them and revise them periodically for better retention. And also I discussed about the mechanism of action of chloramphenicol, where it binds specifically to 50S ribosome and inhibits protein synthesis overall, right? And also I have gone through a drug interaction between penicillin group of antibiotics and oral contraceptives, leading to failure of contraception. And finally, we have gone through rank order of potency of agonists on alpha receptors. It is adrenaline greater than Na greater than iso. If it is on beta receptors, iso greater than adrenaline, following which you have noradrenaline, right? Based on studies, they might have studied the properties and the affinity of these substances on various receptors, and they've given us this order. Affinity depends upon chemical properties. So as far as I believe, it's because of the chemical nature of a particular substance. If you say why your substance has a specific affinity for a receptor, it depends upon the chemical structure and the orientation between the substance and the receptor. Yes, Kaju, you can drop a mail, we'll send you the list of books to be followed, right, including standard textbook list. Yeah, so as I mentioned, it depends upon the chemical makeup of a particular substance. Fine. You still have any questions? Yes, Bernice, glad to see you after a long time again. Okay. Aspirin and oral contraceptive. Yes, aspirin and oral contraceptive would lead to failure of, there can be excessive bleeding as far as I believe. Yes, Richa, potency and efficacy, the difference is, efficacy is the minimal amount of drug that is required to produce the desired clinical therapeutic effect, whereas potency is the maximum amount of benefit which can be derived when comparing two drugs. In fact, we have covered the differences in one of the previous videos. While I also gave you some examples like morphine and pethidine. Citing these two as examples, I have explained you about this specific potency and efficacy. In fact, when you compare morphine with NSAID, aspirin, obviously you know that morphine is the best or effective medication in reducing the pain, right? More effective, more potent, we say. So morphine is more potent because it has maximum benefit being derived in terms of pain relief compared to an aspirin, that is an NSAID. So morphine is obviously more potent, whereas efficacy is nothing but the minimal concentration of a drug that is required in order to produce the required therapeutic benefit. Which I hope you got my point. And Kazi, do refer standard textbook and get back to me. And if you have any further question, drop a mail at talktobedentist@gmail.com. Right? Yes, Neha, join our Google group. You will get all the soft copies pertaining to the MCQs which we are discussing here. Yes, Janani says, hey doc, want to tell you big thanks. I cleared my NEET exam this year. Started my preparation by December month only. Just saw your videos and attended some live sessions in that last 1 month. Glad to hear that, Janani. I'm happy that you cleared and wish you all the best. Yes. So you have any further questions, drop a mail, I'll get back to you. Okay? Yes, Janani, you're most welcome. Thank you, Bernice, for sharing the mail ID. Yes, Anushka, I have already added you previously, I think. Okay? Fine. Then we'll see you again next week with more topics from different subjects altogether, right? We'll mail you, or in fact, we'll share the MCQ soft copy in our Google group by next Tuesday or Monday, and we'll have discussion on Wednesday and Thursday at 8 p.m., right? Yes, definitely we'll add up general sessions, Bernice. We'll do them soon. Yeah. Okay. Good night. Take care. And Richa and Kazi, you have any further doubts or you want further clarifications pertaining to those questions you have asked me today, you can drop a mail, right? Yeah. See you then. Bye. Take care. Love you all. Yeah, spokojno noć.